Meet Sarah, a 45-year-old patient with a history of Crohn's disease and a father who had colorectal cancer. She smokes occasionally and enjoys a few drinks weekly. Using the ADPI framework, let's assess her risk for colon cancer. Assessment. First, gather a thorough history. Sarah's Crohn's disease, part of inflammatory bowel disease or IBD, increases her colon cancer risk due to chronic inflammation. Her family history of colorectal cancer is a red flag. Genetic syndromes like familial adenomatous polyposis, or FAP, can lead to polyps and cancer. Tobacco use and alcohol consumption further elevate her risk, as both are linked to cellular damage in the colon. Don't forget to assess diet and exercise. High-fat diets, obesity, and low physical activity are also risk factors. Diagnosis. Based on this, Sarah's at high risk for colorectal cancer due to her combined genetic, environmental, and lifestyle factors. Planning. Plan for early screening, like a colonoscopy, especially given her IBD and family history. Introduce patient education on modifiable risk factors, a novel term for NCLEX. These are lifestyle changes like quitting smoking, reducing alcohol, and increasing dietary fiber, fruits, and vegetables. Protective factors include aspirin or NSAIDs, folate, vitamin B6, fish, and exercise. For women, postmenopausal hormone therapy may also lower risk. Implementation. Teach Sarah about these protective factors. For example, explain that dietary fiber promotes healthy digestion, reducing colon cancer risk. Encourage smoking cessation programs and moderate alcohol intake. Refer her for genetic counseling if FAP is suspected. Evaluation. Monitor Sarah's adherence to lifestyle changes and screening schedules. Evaluate if she's reduced tobacco and alcohol use and increased protective behaviors like eating more fruits and vegetables. This ADPI approach ensures you're thinking like a nurse and ready for NCLEX questions. Let's tackle the NCLEX question. Which increases the risk of colon cancer? A. Inflammatory bowel disease. B. Family history of colorectal polyps or cancer. C. Tobacco use. D. Alcohol consumption. Or E. All of these. Correct answer E. All of these. Rationale. IBD, like Crohn's or ulcerative colitis, causes chronic inflammation, raising cancer risk. Family history, especially with genetic syndromes like FAP, is a major risk factor. Tobacco and alcohol are linked to higher colorectal cancer rates, often tied to poor diet or cellular damage. Clinical application. In practice, assess patients for these risks and prioritize early screening for those with IBD or family history. Nursing tip. For NCLEX, memorize modifiable risk factors like smoking, alcohol, and diet to spot correct answers fast. Love these nursing tips? Subscribe, hit the bell for daily drops, like, and share with your study group.